That's a fantastic question. And certainly it does seem to be a confluence of multiple events. And I have some slides I'd like to show you guys in just a second so that we can kind of see where we've been and where we're going. So I'm going to just crank those up, and that's probably a good uh, uh, a good mechanism to do it. All right, let's see. So if we just take a look and see kind of where we are, if you look at the number of cases and hospitalizations we're having, you're seeing that we're having a pretty significant increase in COVID patients over time. And what and what we've seen is, when we went through the spring through May and going into June, we were doing reasonably well. But at that time, we were also really seeing primarily the Alpha variant or the UK variant. But going into the summer, the Delta variant has really taken over all the transmission within the state of Mississippi. We have multiple factors. If we think about the Delta variant coming through and it's being far more contagious even than the Alpha variant, combined with the increased activities through the summer, including the 4th of July and other sort of social activities, especially among youth. And then if we add on that our low vaccination rate and the high percentage of people, especially in younger age groups, who are not immune to COVID from natural infection or from vaccination, it really is kind of a perfect storm for an explosion in cases. I will go ahead and share my slides again. One of our biggest challenges is right now is that we're seeing an increasing utilization of our hospital space. Our number of cases is increasing rapidly. Our ICU utilization is starting to rise to levels not seen since last summer. And we're also seeing increased utilization of our mechanical ventilators. You can see that over the past month or so, you can see a sort of a snapshot of how much more intense it's been with the onset of the Delta variant. And we are going to one second, please. My camera is off. And if we look at the age groups, you can see here over time, you can see if we look at what's been happening over the summer, we see a pretty massive increase in the number of cases by age group, which is highly variable. And these are things that we'll share with you guys after the press conference. One of the most important things to say is the vast majority of our cases, our hospitalizations, and our deaths are in the unvaccinated. 93% of our cases over the past month are unvaccinated. 89% of our deaths in the past month are unvaccinated. And if we do a little bit deeper dive, it's important to note that of the deaths that are reported to us, all of the deaths in vaccinated individuals are 65 and older. That's one of the reasons why we've been very focused on trying to do additional protections for those who are 65 and older, understanding that even though the vaccine is highly effective and very safe, that they are somewhat at high risk, especially those who have chronic underlying medical conditions. For that reason, we also are advocating for people who have immunocompromising conditions, such as cancer treatment or lupus or other things like that, to talk to the doctors and see, do they need to be evaluated for a booster dose? There is increasing data out there that shows that certain sets of the population, not everyone, and not even necessarily age-related, but people who have underlying medical issues, such as, if you're on immunosuppressive drugs, if you're on cancer treatment, or if you're a transplant patient, that there may be some value in talking to your physician and seeing if a booster dose is an appropriate course of action. Y'all, we're going to have a rough few weeks. Delta is hitting us very strongly. We anticipate that we're going to continue to put additional pressure on the healthcare system. Currently, there are 13 hospitals in the state of Mississippi that have 0 ICU beds, and a significantly higher number than that have less than 10% availability. If you talk to your hospital administrators, docs, ICU docs, and ER docs, they'll tell you that we are getting to a point where we're actually having to fly patients from the Delta to the Pine Belt to get access to care, because there's really just not that much access to it right now. It's going to be a few weeks, so please be careful. If you're not vaccinated, certainly we want you to get vaccinated. But one of the things is important to know: it takes a while for the vaccine to be effective. So take some common sense steps over the next several weeks to reduce the risk of transmission of COVID. One of those is going to be, if you're doing something of a social nature, please do it outdoors. We know it's much safer if you do it under that sort of design. The other thing that we think you should do is be conscientious if you are over 65 or have chronic medical conditions, as we discussed previously. That's important to consider not attending mass indoor social gatherings of any form. Wearing masks is not a bad idea. Certainly, we think that that's a good way to add another layer of protection, and use some common sense. If you're older, or if you have chronic medical conditions, it's worth considering if the people who are coming to visit you, if they're kids or younger, have they been vaccinated, and could they be carrying COVID? Because we don't want people, especially those who are most vulnerable, to be exposed and look at have an unnecessary adverse event, hospitalization, or death. It's bad right now. Please exercise caution. We are in the middle, or maybe even the first part of our fourth wave. We want to bring as many people to the next side as we can. Thank you, Liz.
Dr. Dobbs, thank you for that. I just want to let everybody know we are having some technical difficulties getting your camera turned on, and we're working on that. And what we will do is I invite any reporters to, Marvin, do we look like we're getting close? Okay, I think we're getting close to having Dr. Dobbs on, but I invite any reporters to ask anything about what Dr. Dobbs said. Feel free, so that you can get him on camera. Hopefully by the time our Dr. Dan Edney is done, we'll have Dr. Dobbs up. So Dr. Edney, can you talk, first of all, a lot of reporters, a lot of the reporters, and Dr. Edney has done a lot of work statewide, and he's well known by providers. And he is actually doing some very important things with providers right now. But first, I want you, from your personal experience as a physician in Vicksburg, to talk about what it's like when a hospital is overwhelmed. You've dealt with it. I think it'd be good for us to understand that and for the public to understand that. Could you talk just a little bit about that?
Sure, and thank you, Liz, and thank you, Dr. Dobbs. Pleasure to be with y'all today. As I think back over the last year, some of the most difficult days I've had in the practice of medicine have been in the midst of getting through late November, December, and January earlier this year. Those are, we called, and many times in our practices, we call those the killing times, because that's when we were just seeing just the virus attacking families wholesale, related to Thanksgiving and Christmas holidays and family gatherings. I specifically remember one day I had two patients who were very close to needing the ventilator that we were trying to transport to the hospital, and they each were in the back of their own ambulance, and they had to stay in the back of the ambulance 5 hours at the hospital waiting for the ability just to get into the emergency department. And then once individuals were in the emergency department, it would be days before they could get a hospital room. And of course, during that time, families were not allowed in. There were no ICU beds. We were not just transporting patients around the state, we were transporting patients from Mississippi to Texas, Mississippi to Florida, to try to get ICU beds. And most of the public don't really understand how close we came in that second week of January to the healthcare system just breaking from the stress that we were under. Thankfully, vaccines arrived in terms of enough vaccine to start vaccinating those who are most at risk, those over 75. And as soon as we started deploying vaccine to the general public, the numbers started to calm down and the stress started to be relieved off of our healthcare systems. And it was not just the healthcare systems that were under stress, it were the families of the loved ones who were in the hospitals alone. Those who were stressed at home that normally we would have had in the intensive care unit, we're having to treat them at home because there were no beds. The stress of doctors and nurses all over the state on the front lines, other healthcare workers going through all this, and then the stress of our families who were worried about us on the front lines. And of course, we were worried about taking COVID home as well. Thankfully, we were vaccinated by that point. The these experiences all have brought home in vivid detail to doctors and nurses across the state just how serious this was. And now we're dealing with a variant of COVID that is twice as contagious as what we were dealing with before. So we just don't need to go through this again. I had an employee in clinic who teared up and told me, I can't go through this again. And we have an answer so that we don't have to go through those killing times again. And that's vaccination. It's very simple. If you're eligible to be vaccinated, get vaccinated and wear a mask when you're in situations where you're around a lot of people that you don't know their vaccine status. We have an exit ramp from this pandemic. We just need to take it. And the health department is doing everything that we can to facilitate vaccinating the general public. Everybody who's familiar with the yeoman's job that our National Guard and health departments did around the state and our mass vaccination clinics, well, that's over with now. And now we have just a much lower demand for vaccine, and we're having to basically convince people one at a time that the vaccines are safe and highly effective, as Dr. Dobbs has pointed out. And we're doing that by getting vaccine everywhere that we can. That includes doctor's offices now. And we have enough vaccine that physicians anywhere in the state have the capability of becoming vaccine partners with the health department, becoming registered and having vaccine delivered to their individual clinics to administer to their patients at the time of an office visit, if they so choose. We are seeing a lot of patients that are still sitting on the fence. They just don't know. They're hearing so many different things. They're hearing from doctors that it's safe and effective, and they're hearing from Facebook practitioners that it's going to kill us all. And we are here to tell you, as America's physicians, 96% of us are fully vaccinated voluntarily because we know it is safe and we know it's effective. And Dr. Dobbs has already pointed out to you the efficacy based on those who are suffering most right now, and that's the unvaccinated. And this is totally preventable if we can just convince our patients to get vaccinated. We know the number one individual that can do that is the patient's personal physician or provider. And we need these conversations to be held at the time of office visits. We need you to call and talk to your physicians. Physicians matter, and they desperately matter in this situation of vaccine hesitancy. And I've seen in my practice that patients oftentimes just need to talk to me. They don't know who Dr. Fauci is. They don't know who the talking heads are on television, but they know who I am. And they know that I've been with them for 30 years. And they know if I'm vaccinated and my family's vaccinated and I want them to be vaccinated, then they can trust me. And many have chosen to be vaccinated after talking to me. So we're encouraging our physicians and providers around the state to sign up and become vaccine providers and provide it at the time of the office visit, just like the flu shot. If you're looking for where to get a vaccine, they're readily available and they're free. And you can go to www.vaccine.gov and look in your community where vaccine is provided and what type of vaccines, as you have a choice of the three. And then you'll be able to see if your local doctor is providing the vaccine in his or her clinic. We are working hard to get our children vaccinated by having increased access to the Pfizer vaccine through health department depots. The health department around the state are providing access to clinics so that they can get doses as few as 6 at a time. And the big struggles before were the difficulty in private clinics being able to handle the volume of Pfizer vaccine that was required by the government. But your health department has worked hard to solve that problem. And so pediatricians and family medicine docs should be able to have Pfizer in their office to vaccinate those 12 to 18-year-olds. And we are asking our providers, our physicians around the state to consider our Adopt a School program, where you will help volunteer to get our school-age children who whose parents are willing and wanting the vaccine for their children to facilitate vaccination of our school-age children. We know that vaccinating our children will make school much more safe and more normal. If we want this fall to be more normal, the route is through vaccination. And we at the health department have been working tirelessly to provide vaccine in every way that we can. If you have questions, you can look at our website regarding the Doctor School program and the CCVP part of our website for providers who are familiar with that, or you can call me directly, contact me directly, or you can call the health department 601-576-7751.